Hello everyone, welcome to this edition of Dr. Krob's Headache Vlog. I'm Dr. Alexander Krob, headache expert. In today's edition of Dr. Krob's Headache Vlog, answers to your questions about clinical research, chiefly, why would I want to be in clinical research, and how do I find a clinical research study in which to participate? So, if you are a person living with headache, you probably already understand why you would want to participate in clinical research, and the answer is related to the fact that there are very few treatment options for people with headache disorders that are highly effective as well as tailored to the individual diagnosis. So, as an example, let's take a look at treatment options for chronic migraine, which are shown here. And if you look, there's only a handful of drugs with level A evidence, in other words, highly reliable evidence that they actually work. And if you look, none of them, at least on this list, is actually developed for people with chronic migraine. They include 2 drugs initially made for epilepsy, divalproex sodium and topiramate, a couple of drugs made for people with high blood pressure, chiefly things like propranolol and metoprolol. And then you could potentially include in that list a drug made for depression, which is amitriptyline. And then, of course, you might also want to include a drug like Botox, although that also was developed for another reason, which was cosmetically, and then only found to be accidentally useful for people with chronic migraine. Of course, there was also Aimovig, which was introduced a few months ago, and that is now the very first drug that is intentionally made to help people with chronic migraine. So if you would like access to new medications, probably because a lot of these other medication options are not working for you, and there's no real surprise there, right? Because they weren't really made for the diagnosis that you actually have. They're kind of surrogate treatments. Then what you need to do is you need to have access to new medications. And how do you get access to new medications? How are new medications like Aimovig developed? Well, they're developed by means of clinical research. And how does clinical research work? Well, clinical research works by recruiting people with a diagnosis, people like you, who are interested in not only helping themselves, but helping other people who are also living with headache. So how do you find a clinical research trial in which to participate? And I'm just going to go to a different page here, and we will talk about that. Let's just open up a web browser right here, and I would type in www.clinicaltrials.gov, right up there, www.clinicaltrials, all one word, .gov, and this will bring us to the National Library of Medicine Clinical Trials Database. So here we are at the National Library of Medicine Clinical Trials Database, which pretty much has every privately and publicly funded clinical study around the world. And what you want to do is you want to go down here and click Find a Study. And I would first of all start the search with the recruiting and not yet recruiting studies. Now, in the condition or disease box, you can put in a specific diagnosis like migraine with aura, or you could put in a non-specific diagnosis like headache. If we type in headache here, we can just sort of click the box on headache, and then in the other terms field here, we could get more specific. For example, we could put post-traumatic headache, which actually, let's do that because there was a question about how to find a particular study on post-traumatic headache. So there's post-traumatic headache, and then down here in the country box, you can choose the country in which you live because that's going to be the most convenient trial to participate in. You can also become even more specific. So for example, if you'd like to find trials only in your state or only in your city or within a certain distance from your state and city, up to 300 miles radius, you can fill in these boxes here. But for the purpose of this demonstration, let's just click search at this point. After you click search, in this case, you will find that there are 12 studies that meet the criteria that we're searching for. And they are listed right down here. Now, if 12 is difficult to filter through, there are additional filter settings that you can click or unclick over here. And what I would do is I would probably unclick the not yet recruiting box. And then if I wanted to be more specific to make sure that I'm screening for studies that pertain to me, I would click adult 18 to 64. And down here in the study type, I'm going to click interventional because I am interested in a study that plans to conduct an intervention on my headaches. And what is an intervention? It could be a treatment, it could be a new medication, it could be a lifestyle change. All of those are called interventional, and that's what I'm interested in. Because if you don't intervene, it's not going to change, right? So then I'll click apply. In this case, clicking apply really didn't narrow down my options, but what it did is it made sure that the options are actually all relevant to me. They're all interventional trials that are currently recruiting adults from the age of 18 to 64. And actually, it's really nice to see that there are 12 studies out there that could potentially use someone like me as a participant. Now, in terms of post-traumatic headache, there is this drug study involving metoclopramide. There is a study here using cognitive behavioral therapy. There's another pharmacologic study involving a drug called prazosin. There's a nutritional study. There's a study involving a device. And there is a study right here which compares a CGRP drug called fremanezumab for treatment of persistent post-traumatic headache. And that actually is the vector trial that I have referred to before. So let's click on this study title here in the search box, in the results box, and see what it shows us. After you click the title in the results box, you'll be brought to this page here, which is the study information page. You can see a lot of information about this study to get an idea of whether you might be a good fit. First of all, and here is the study description, and it is a one-paragraph explanation of what the study hopes to achieve and how it hopes to achieve it. There are important words to look for that indicate a high-quality study, and they include words like double-blind and placebo-controlled. And what does that mean? Placebo-controlled means that some people entering the study will be randomly assigned to participate in a placebo group, which does not receive the active compound, and another group of patients, sometimes not necessarily the same number, will be chosen to participate to receive the active compound. And that actually is one of the highest, most reliable ways of conducting a clinical research trial. Now, of course, some people ask a question of, well, why would I want to participate in a study if I could receive the placebo? And there are a couple of reasons. First of all, the placebo group, at least statistically and scientifically, is as important to the goals of the study as the people who are receiving the active compound. So if you want to make a difference in the lives of other people with headache, not necessarily yourself, being part of the placebo group is just as important. Now, another reason is that many studies have a design where even if you start in the placebo group, during the study you may cross over into the group that is receiving the active compound. That's called a crossover study. And there is another way of designing the study, usually an extension of the study that offers an open label extension, which means that all of the people who participated in the study will receive an active compound for a period of time. And so that's another reason to participate in a placebo group. The third reason to participate in a placebo group is actually very interesting, and it is related to the idea that there is something called a placebo effect. And that means that in every study, every recent study of any headache treatment that I'm aware of, even the placebo group actually improves. In fact, in most headache studies, the placebo effect is so strong that it is often very difficult to find an active drug that works better than the placebo. And a lot of people think of the placebo effect as sort of a negative kind of Jedi mind trick on people, but it's not. It's actually real and it's scientifically measurable. And what does it come from? It doesn't come from a mind trick. It comes from the idea that people who are participating and receiving a placebo are getting access to headache experts. They're getting a lot of very valid medical attention. They're getting new information that subtly helps them change their lifestyle. And I think another one for a lot of people is that they feel a sense of empowerment because they are participating and taking charge and participating in headache research, which actually that motivational uplifting feeling probably contributes greatly to what's called the placebo effect. And I would again encourage you to make sure that, or to try and understand the placebo effect in this case as a good thing. And it's the third reason why you should participate in a study, even if it could mean that you would actually be receiving the placebo. So let's go down here a little bit more. There's some more commentary about the study design. So for example, this study is looking for 172 participants, and you might think that that's actually pretty easy because there have to be 172 people across the United States who want to participate in this study, but actually it's really hard. My clinic is enrolling people in this study, and we have found 1 or 2 so far of all of our headache population. So it's very important not just to think that someone else is going to do this, but that your role, your participation is really important. So if you go down a little further, the outcome measures will show what the study is actually trying to achieve. And usually those are primary outcome measures and secondary outcome measures, and that's sort of what they want to measure. And in this case, as is typical for migraine prevention drugs, it's looking for a change in the monthly average number of headache days. So further down here sort of starts to answer your question about would you be the right person for this study? And those are called eligibility criteria. Now, those eligibility criteria include both inclusion criteria and exclusion criteria, and some of them are kind of easy, like you have to weigh more than 99 pounds, and some of them are actually kind of difficult and technical, like you have to have a diagnosis of persistent post-traumatic headache. If you don't have that diagnosis, how do you get it? Well, it's important to understand that these criteria are really a listing for physicians who are trying to determine whether their patients are appropriate, but in all likelihood your physician will never have heard of this study and they won't know. So the fortunate thing is that right down here in the contact section in every one of these studies there is a number or an email or an address that you can call, and what they will do is they will usually link you up with what's called a local site, and that local site, if you give your contact information, will call you and they will help pre-screen you for some of these inclusion and exclusion criteria. And if it looks like you could be a good fit, they'll invite you in for a pre-screening visit and really go into some details. And so there you go. That's why you would want to participate in clinical research. And in a nutshell, it's because it's good for you and it's good for other people with your diagnosis. And the other question is, how do you find a clinical research study to participate in? And the answer is you go to www.clinicaltrials.gov and do a quick search. So thanks everyone for watching. This has been another edition of Dr. Krob's Headache Vlog. I'm Dr. Krob, headache expert, and I'll see you next time. Bye-bye.